It has been just over a week since the FDA announced it will not ban a certain type of breast implant linked to a rare cancer. So now what? Is everybody in the clear? Dr. Nicholas Howland from Nicholas Howland Surgery is here to dispel myths and separate fact from fiction. Welcome to the show.
Thanks. It's awesome to be back.
Yes, well, I think this is an incredible topic because so many of us ladies have had a watchful eye on all this news coming out with the FDA, because I think you hear that word thrown out there in the media, that cancer word, and that's scary, whether you have breast implants or we're thinking about getting them.
Oh my gosh, I mean, that's why I wanted to come on, because it's so easy to hear cancer, breast implant, and then to make that jump to implants cause cancer. Oh my gosh.
Yes.
And that's not what this is at all. And the FDA made this announcement just a few weeks ago that they're not going to ban a certain type of breast implant. But we've known for several years that there is an association with implants and this type of cancer. It's anaplastic large cell lymphoma, which is a mouthful.
Yeah, it is a
so
mouthful.
It's ALCL is the abbreviation, and it's not breast cancer. This is a cancer of the immune system. It's a type of non-Hodgkin's lymphoma, and it's associated though with breast implants and seems to be associated with a particular type of breast implant.
Okay, so we don't all need to go get our breast implants removed right now.
No.
That's not the issue. What is the specific type of implant that is causing problems for people?
I brought a textured implant to show you, but I want to tell you the difference between association and causation. So, because that's what's important here, and that's what this argument is about. If we suddenly had all these people around the world that were dying randomly, had no idea why, and we looked into it and it turns out everybody who was dying had a red door, then there would be an association, right? Red doors, people dying, there's an association. But it wouldn't make sense to go out and say, no more red doors, take all the red doors out, and red doors are causing this. So that is the difference between association and causation, and that's what's happening here. There is an association with these breast implants, but we don't know that there's a causation. And the FDA has seen it's not scary enough, it's not dangerous enough to pull these implants, but it's something we need to continue to look at.
What's interesting is the implants, the textured implants that we're seeing an association with, you don't even actually use, and many doctors in Utah don't use either. I know that they're used a lot in Europe, but this is the textured implant, is that right?
This is the textured, and you can feel it, and you can feel the difference is it's a very kind of grippy surface. And this is the smooth. So these are both silicone implants. It's the outer shell that we're talking about.
Okay, so this is what you use in your office.
Yes, I use
this guy here.
I use smooth implants, usually always round like this. And the textured device, when they made it, was intended to kind of stay in place and incorporate better into the body, and it does very well.
It's grippy. It's definitely, you can see why that would have been appealing for some people. I read an interesting statistic as I was looking into this myself that said there are no known cases in the entire world in a woman with just smooth breast implants. Zero. That is so significant to know that people with these implants, which are the majority of us, are safe, are totally safe right now.
Absolutely.
Okay, so while cancer isn't a concern when people come to you, there are some other things that we should absolutely keep in mind and questions to ask ourselves if we're thinking about getting a breast augmentation. What are some of those things we should be talking about?
My main focus with my patients is I want you to be educated. And so, go see 5, 6 different plastic surgeons. Just know the choice that you're making and what you're getting into. As far as breast implants go, we're going to talk about the different types. We're going to talk about textured and smooth. We're going to talk about silicone and saline, different sizes, different shapes, where we're going to put the implant. But I just want you to understand, I want you to be doing this for you, because my entire approach as a plastic surgeon is I think that plastic surgery is empowering for you. And if you're educated to make a decision that's good for you, then you can be empowered.
That's what I love about working with you. And I will say, you are very unique. I've worked with other plastic surgeons, talked to other plastic surgeons all the time on the show, and a lot of time it's I could fix this, this, and this, and this with you. And you're not that way. Your very progressive, non-sexist approach is so refreshing. You're board certified, which is unique. And then also, you're personal. I thought when I worked with you, I was special because he gave me his personal cell phone number, which I may or may not have called him at 3 a.m. a couple of times. but I found out I wasn't special. You do that for everybody.
Everybody gets it.
So cool.
And that is my personal cell. It's not a work phone. It's not a burner phone.
Yeah. You have an open house coming up in conjunction with Clarity Skin.
Yes.
Incredible, in Draper, happening on Wednesday, May 15th between 4 and 7. And this is where you can just come, pick Dr. Howland's brain a little bit. Ask him your questions.
Allie's going to be there.
I'm going to be there.
So that's the draw.
I go, I'm not the draw. Really, I'm not. But I will be there with my mom. I'm going to be, she's getting, don't tell anyone, she's getting a hydrofacial, and I'm going to give her a card on Sunday for Mother's Day telling her we have a girls' day out on Wednesday.
That's the best Mother's Day gift.
A fun thing to do with your mom or just with your girlfriends, and we'll link you to all the information. Dr. Howland, thank you for setting us straight on boob jobs. No pun intended. Coming up next.